Are boxers prone to certain neurological issues? Boxing is a popular and demanding sport that requires immense physical and mental strength. Fighters risk their health every time they step into the ring, enduring powerful blows to the head and body. With repeated exposure to such forceful impacts, it is natural to wonder if boxers are more susceptible to certain neurological issues. In recent years, concerns regarding the long-term effects of boxing on brain health have gained significant attention. This is mainly due to studies suggesting a link between boxing and chronic traumatic encephalopathy, CTE, a degenerative brain disease. CTE is often seen in individuals with a history of repetitive head injuries. Research has shown that microcavities, or small holes, can form in a boxer's brain due to repeated concussions. These microcavities are indicative of brain damage and can lead to a range of neurological problems. These can include memory loss, difficulty with speech and motor skills, depression, and even early-onset dementia. Additionally, boxers are particularly vulnerable to developing Parkinson's disease. This neurodegenerative disorder affects the dopamine-producing cells in the brain, leading to tremors, slow movement, and rigid muscles. Numerous studies have suggested that repeated head trauma, such as that experienced by boxers, may increase the risk of developing Parkinson's disease later in life. One study conducted by the Cleveland Clinic Lou Ruvo Center for Brain Health compared boxers to mixed martial arts (MMA) fighters. The research found that the boxers had a higher prevalence of brain abnormalities, including smaller brain volume and more brain lesions, compared to the MMA fighters. These findings indicate that the repetitive blows to the head in boxing may be more damaging than the varied strikes in MMA. While the evidence suggests a potential link between boxing and neurological issues, it is important to note that not all boxers will develop these conditions. Factors such as genetics, individual susceptibility to brain injury, and the use of protective gear can all play a role in determining an athlete's risk. Furthermore, advancements in safety measures have been introduced in recent years to address this issue. For instance, the World Boxing Council, WBC, has implemented stricter regulations regarding medical exams and suspensions for fighters who suffer concussions. The use of protective headgear during training sessions is also widely encouraged to minimize the risk of head injuries. In conclusion, boxers face a higher risk of developing certain neurological issues compared to individuals who do not participate in high-impact sports. The repetitive blows to the head increase the chances of microcavities forming in the brain, potentially leading to memory loss, motor skill difficulties, depression, and premature dementia. Additionally, boxers are also susceptible to developing Parkinson's disease later in life. However, it is essential to remember that not all boxers will develop these conditions, and various factors contribute to an individual's susceptibility. With the implementation of stricter regulations and the use of protective gear, the boxing community is working towards minimizing the risk of such neurological issues among its athletes.